All right, we're here with Greg, who is having some knee issues. I'll kind of let him briefly explain what sort of pain he's been having.
Yeah, so hi, I'm Greg Mackey. I'm co-owner of Pure Core Health and Fitness here, and I'm with MAM Innovations, and they do some awesome treatments in pain mitigation, and we're happy to host him here at Pure Core. And so he uses this electrical stimulation device called an ATOM here. If you see my knees here, I'm actually feeling electrical current in my knees right now. My right knee is having some problems here, but as you can see, he's compensating on this side too. This is a very important part to elicit a balance to the neural responses that we're getting. So, and then there's also a passive wave, which literally is a lot easier, and it just brings blood back to the muscle area. So that's kind of what's happening right now. And right now I'm feeling this, and we're going to do some treatments. And that's the big difference between this and, like, say, another electrical stimulation device like a TENS, is that it's all about the treatment, and it's all about this communication wave, this high frequency wave that really sets it apart. And athletes, both professional and amateur athletes from around the country and even different parts of the world, they use it, and so do teams and coaches and trainers. So it's really a heck of a device, and MAM Innovations has got it here in Michiana. So pretty cool. We're going to get started. All right.
So before we discuss and start the protocols and the exercises, we were able to use a patented device. We were able to search his knee and find out exactly which part of the tissue is not firing as well or receiving messages from his brain. So we've identified those spots, and as Greg had mentioned, we mirrored those images or those pad placements on the opposing knee, so there's no compensating or compensatory issues. So we're going to be doing a series of exercises. So these are called sit stands, and we focus on the exact accurate form. So if we notice, he is at a completely 90-degree angle with his knees, and we'll do a series of exercises and to wake up those dormant muscle fibers that are not firing in his knees, and that will take off the pressure that he's feeling here in the joint system. We're about ready to start the exercises. So Greg's in perfect form. So what he's going to be doing is doing a sit stand. So he's going to stand up using only his hamstrings and his quadriceps, so in maintaining his form. So key thing here is his knees do not go forward. They remain in a stationary position while he stands up. He's going to stand up, and then he's going to sit down in the same fashion. Knees do not go forward. Up. Down. So we're going to focus. Keep those knees. Now stick your butt to the wall. Going forward. So now we're on the second wave, which is we call the recovery wave or the passive wave. The first one was a active wave, which was high voltage and low frequency. It's a dual wave band. And the first wave, we were activating and contracting those muscles, recruiting oxygenated blood to those areas. And now we're on the passive wave, which is very low voltage and high frequency, which is going to help with the recovery and also communicate with the nerves deep down in the tissue. So we'll do this during the session, in the middle of the sessions, and then we'll go back to the active wave. Greg, how are you feeling?
Good, actually. Yeah, that first wave will you can definitely feel it. It's you can see it working, my muscles, especially my quadriceps. So one of the things that's interesting too is that the ATOM device is not just necessarily for pain management, but it's also for neuromuscular recall, and for athletes, that's a big thing, the neural response rate and whatnot. I happen to notice that I was having trouble at first standing up. I wasn't getting the strength I needed out of my hamstrings to get that technique right. About halfway through these treatments, it was a whole lot easier. I could feel almost like my hamstrings were on autopilot. So it was really something where I was getting that technique, and I think you know, that ATOM most certainly was helping me with that technique. So I can certainly see how that benefits the athlete too when they're trying to perfect whether it's their golf swing, tennis swing, throwing arm, and other types of things that they use this for on an athletic training level.
So would you agree that the technology communicates with the central nervous system, basically just firing those muscles at nanoseconds on demand?
Yeah, I do, and I think that's what's hugely important, because it almost felt like my whole mind-body connection was beginning to speed up and take over, and making that technique work of just this standing up and utilizing the posterior side, my hamstring side. So I think that was very significant and something that I noticed just in this treatment.
Sure. And the technology and the theory behind it is that we're retraining those muscles to perform anatomically correct, which alleviates a lot of that pressure and increases movement, etc. So thanks for sharing.
Perfect.